Hey guys, Danny Bossa from the TRT and Hormone Optimization YouTube channel. Hope you're all doing well. So I am writing a book, and I've only got a couple hours a week to devote to said book. So it's going to take me a little bit of time to finish it off, but I'm hoping, and maybe this sounds a bit ambitious, that within a year's time, I should be able to release it, because what few hours I do spend on it, it is actually going pretty well. I'm getting through it pretty quick. I've got several chapters written already. And one of the chapters I wrote on was a topic that I don't really think that we've covered sufficiently on the channel. So I thought I'd share a little bit of it because I think it would help a lot of you guys out. There's a lot of guys that join the Facebook group trying to determine whether or not they should get on TRT. And I get a lot of messages from guys that are watching the channel and hearing all the benefits of TRT, and they're trying to decide whether or not it's something good for them. So before I go on, I need to make something absolutely crystal clear, that the Facebook group, the YouTube channel, and even this book I'm writing is not meant to be some sales pitch to convince you to get on TRT, okay? These are there for the sole purpose to ensure that you feel your best regardless of method, okay? So first I want to go over some of the symptoms that are associated with low testosterone or even androgen resistance, okay? So one of them is being anemia. You've got brain fog, which is like poor concentration and memory. You've got decreased levels of endurance, decreased levels of overall energy, decreased sense of well-being, decreased strength. Erectile dysfunction is a huge one. Fatigue, just general, feeling malaise. Gynecomastia, which is the development of breast tissue. I had that really, really, really bad prior to TRT. Increased body fat, infertility, insomnia, irritability. Maybe you got a lot less beard growth than the people around you, or less body hair. Loss of lean muscle mass. You got low hemoglobin, which is another one. Moodiness. Osteoporosis is basically a disease where you have a loss of bone mineral density. Perhaps you've got reduced semen production, reduced sex drive, reduced testicular size, and even some symptoms of depression. Okay, now this is not by any stretch of imagination a complete list of symptoms, but some of the bigger ones, right? Now, let's follow that up with a list of some of the causes of low testosterone. So not the symptoms, the things that actually cause your testosterone to be low to begin with, okay? So you've got acute or chronic, which is short-term or long-term illness. Aging is an obvious one. Alcohol abuse, anxiety. If you're going through chemotherapy, will definitely tank your hormone levels. Cirrhosis. Any type of concussion or any form of traumatic brain injury is a huge one. Diabetes, for sure. And exposure or constant exposure to things like environmental estrogens, phytoestrogens, xenoestrogens. Anybody who's gone through a crazy crash diet with extreme weight loss, for sure that can occur. Anybody with high blood pressure, high cholesterol, high prolactin levels. Hypothyroidism is another. Kalman syndrome, Klinefelter syndrome are two big ones. Kidney failure, for sure. Any type of metabolic disorder, obesity, any type of opioids, some other medications can definitely have an impact on hormones. Perhaps you've used some kind of anabolic steroids in the past. Perhaps you've got a pituitary gland tumor or any type of pituitary dysfunction. Perhaps you've got sleep apnea, smoking, big one. If any of you guys are on this channel and you're smoking, that's literally the first thing you got to get rid of. Stress and testicular trauma or failure. And again, these are not a complete list, okay? So as you can see, maintaining optimal testosterone levels can be quite the challenge, especially in this day and age, where virtually everyone around you has, some issue or another. And what's even more fascinating is that those who do have optimal levels of testosterone will be in a significantly better position to reduce their chances of any of this happening with them and potentially even avoid them altogether, okay? So the question now becomes, how do you know if you need testosterone replacement therapy? You'd figure simple, right? It's actually not all that simple. So it would be easy to say, I have some of those symptoms, therefore I should take TRT. And that would be wrong. Many men's health clinics would be quick to convince you that TRT is exactly what you need. And this is often not the case. These clinics have a mentality of, we're either too lazy or too inexperienced to figure out why you have these issues. So we'll just give you TRT and be done with it. Or it's maybe something like, we can't make any money if you just improve your lifestyle. Therefore, please sign up for this lifetime commitment. This is not how things are done, okay? The goal here is to determine root cause. The goal here is to determine why you feel the way you do and what may be causing the symptoms you have, okay? Now, there's some doctors out there who are passionate enough about the subject and experienced enough to try to figure things out for you instead of just jumping the gun and convincing you to get on TRT. Now, some of these docs will simply measure your total testosterone levels and a couple other things, state that your levels are not optimal, and write a script for TRT. So now you're immediately putting yourself in a position where you'll be taking testosterone from an exogenous or outside source, which will quickly suppress your own natural production, and this is going to be a lifetime commitment, all right? So, what if you would have instead made a commitment to first figure out what was causing the issue to begin with? What if it was something within your control all along? This is where a competent physician or medical professional comes in, one who's going to do what's necessary to get a full grasp of your lifestyle and habits. Okay, now a competent physician in this type of situation should be asking you questions such as, what is your diet like, generally speaking? Do you eat a lot of processed food? Do you consume high sugar foods and drinks? How much alcohol do you consume in an average month? Do you smoke? It could be tobacco or cannabis or otherwise. Have you or are you currently regularly exposed to any type of chemicals? Have you measured the quality of your drinking water? Do you filter it? Have you replaced all your body washes and shampoos and cosmetics with natural products that are chemical free? What are your stress levels like? What do you do for a living? How is your sleep quality? How many nights do you sleep? How many hours a night do you sleep, I should say? How much time do you spend outdoors? How often do you get exercise? Are you taking any kinds of medications or supplements? Are you potentially diabetic? Have you ever had a concussion or any form of traumatic brain injury? Have you ever had any trauma to your testicles? Have you ever had a test done for vitamin mineral deficiencies? Okay, so you see where I'm going with this. The goal here is to make you is to make sure that you're using the best method possible, okay? So ideally, you need to address the list above at the very least, because why would you get on a lifetime commitment of injections or creams if it was simply due to something like a vitamin deficiency that you could have easily corrected? What if it's just because you're smoking 2 packs a day or going out drinking with your friends and getting bombed 3 times a week? What if you had sleep apnea and you didn't know? Wouldn't you want to see if you could first figure out why you feel the way you do and then see if there's a way to fix it? This is the problem with most men's health TRT clinics out there. They simply do not have the capacity to make inquiries like these to see if they may be able to save you from some, lifetime commitment. Why? Because there isn't much money for them to tell you to first stop smoking and cut back on the alcohol to see what impact it has. They want to sell you a treatment, okay? I want to ensure you're equipped for any conversation you're going to have with any medical provider, okay? So step 1, you need to figure out if there's something that's making you feel like shit before even entertaining the thought of TRT. And please trust me on this one. Now, TRT can be explored if and only if you've been doing everything in your power to be as healthy as your life permits you to be. This testosterone replacement therapy is not a magic bullet. It's not going to make you breathe better if you smoke. It won't prevent hangovers from drinking. Okay? You need to realize that you're only as strong as your weakest link. So if you've been working on your health, but your hormones are still in the toilet, TRT is going to help a lot. Now, if your health is a disaster and you think TRT is going to make you better, I got several bridges to sell you, and you're going to wind up being unbelievably disappointed. Okay, so in case you didn't figure it out the first time, first figure out if there is something that is making you feel like shit and try to improve it. All right, so I hope you guys found this beneficial, and stick around. There's a lot more great content, and have a good one.
This video was sponsored by online pharmacy NP Labs. Use the link in the description to get a 5% discount on your first order. It's where I get my compounded testosterone cream, pregnenolone, DHEA, tadalafil, peptides and much more.